My name's Bill Connolly. I'm from Boise, Idaho. As a boy, I grew up in New York, so traveling to and from New York has been enjoyable for me. I've been Dr. Samadi's patient now for a year, and I'm very happy with how things are going for me personally. The PSA test I knew was advised for men as they get older, and my father had an enlarged PSA, enlarged prostate. I don't know what his readings were, and it wasn't something that ultimately ended his life, but we knew there was an issue there, so I started checking myself in my 40s. I think everybody should do it. I think they're foolish not to, even though now some of the recommendations that they're coming out and saying don't do it. Only a small percentage of men will it impact their lives. But if you're one of those percentages like I am, it has a dramatic impact on your life, and I think you'd be foolish not to get tested. It was a combination of things. I researched when the PSA got high and I got diagnosed with having cancer in the prostate, I started researching what my alternatives were, and my results originally allowed me to just watch it and do active surveillance instead of surgery or radiation. But then some of the results changed, and I realized that I had to take a more aggressive approach. So I started looking for a surgeon that could do the surgery for me. And in that research, I found Dr. Samadi was the most experienced surgeon of this type and had a better result in terms of sparing the nerves. And that was very important to me. Facilities are excellent. Both the hospital was over the top. It was terrific care, terrific facility. I couldn't have been happier with the hospital. And then of course the doctor's office is very nice too, and the staff is very helpful. Oh yes. Everybody's very caring, thorough, answer any questions you have. I don't feel rushed. It is efficient. You get the feeling it is efficient. There's not a lot of time wasted, but there is enough time to get your questions answered. I'm doing very well. I think my biggest fear was being incontinent, which I'm 73, so being impotent was an issue, but incontinent would have been an actually bigger quality of life issue for me. And I've done extremely well with that. I'm perfectly continent. I don't have to wear anything special or do anything special, and I'm very happy with that outcome. Don't be afraid to get tested. I think some men, it's partly a kind of a macho thing. I'm not going to get that checked, but I think that's foolish. It's a simple test. It doesn't take any time. You're foolish not to do it.